One thing is stop share. I am close. May I ask? Okay, because okay now. Welcome to the late Millennium Television Yuan Day series. Welcome to an exclusive interview and interactive session with Dr. Serdar Savas on disease or health. In support of the World Health Day 2023, which is April 7, and celebrate the 75th anniversary of the World Health Organization, which was formed in 1948. The World Health Day dedicated to the theme Health for All. I am Bircan Ünver, founder and president of Late Millennium Organization, a charitable human advancement organization, which was formed in 2001 based in New York. And I'm also executive producer of the Late Millennium TV, which was formed at QPTV in 2000. Now, as it appears on our flyer, Dr. Serdar Savas with us today, and he is the president, Turkish Society of Public Health Genomics and Personalized Medicine. We'll get on the personalized medicine more. Co-director, European Center for Public Health Genomics, Maastricht University in Netherlands. Member of the Health 22 Committee of the European Region Office of the World Health Organization from 2010-2011. We'll get to know about Dr. Savas more based on his biography shortly. And now I'd like to welcome to Dr. Savas. Welcome, Dr. Savas.
Thank you very much. Thank you for your invitation, for this nice opportunity to share my views on personalized medicine, on World Health Day, and especially WHO's Health for All policy, which I served for many years at WHO European region. So it is a topic from my heart.
Great, thank you. To set out of the ground of this interview and interactive session, I would like to introduce you a little more formally, because we are, especially the late millennium, is undertaking this health issue. Confess that I am not an expert, and late millennium organization usually didn't deal or presented ideas in relation health. But at the same time, as part of the UN associated NGO, we can kind of also what's going on in the world recently and last couple of years, we can just kind of isolate ourselves. And once we met with you, it's a kind of provide a great opportunity, and your kind accepted our invitation. So for set out the following potential questions, I'd like to introduce you formally to our viewers. Yes, and once again, welcome, and based on your biography, Dr. Savas is one of the first physicians and scientists who have applied genome-based information into personalized preventive medicine in the world, and is one of the pioneers of this field. After serving as Deputy Undersecretary of the Turkish Ministry of Health and Director of Program Management at World Health Organization, WHO in Europe, Dr. Savas established GENAR Institute for Public Health and Genomics Research at Hacettepe University Science Park in Ankara, with researchers and scientists from Hacettepe University in Turkish GENAR. Under his leadership, GENAR Institute developed Gentest as a personalized healthcare model. In 2004, Dr. Savas founded Gentest Institute to work on public health genomics and personalized medicine, which has been developing innovative solutions for prevention of the major chronic diseases and their complications. Gentest is based on the 7K medicine concept developed by Dr. Savas, which refers to personalized, predictive, preventive, comprehensive, precise, evidence-based, and participatory medicine. Words that all begin with K in Turkish. Dr. Savas has been working on the vision of integrating 7K medicine in healthcare services in Turkey and around the globe. At this point, dear guests, please write your topic-related comments and questions for the interactive session in the chat box. And please mute your mic if you are not asking questions during the interactive session. So we wish to avoid any background noise if possible. Yes, without further ado, now I would like to start off with my first question to Dr. Serdar Savas. Welcome again, Dr. Serdar Savas. It's great to have you with us today. And yes, the first question is in my mind, disease or health? Dr. Savas, I assume that everyone's responsible will be, of course, health to this question, or who chooses disease versus health. In other words, what is the underlying message of the title of this program in connection with health for all?
Thank you very much. Health for all, the motto of the World Health Organization since 1977. Halfdan Mahler, that time he was the Director General of WHO, he introduced this concept, primary healthcare and health for all. So the first word, health, means being healthy. It is not only absence of disease, but this is a fully healthy situation, mentally, physically, and socially. So this is the emphasis of health. The second word, all, means equity. So it should be distributed among human beings, within the societies, within different social classes, between different countries, different continents. Health should be distributed equally. So health for all is health gain and distribution of it equally. So this is the approach. However, now I will give you some numbers. In the world, all military expenditures, including NATO, United States, China, Russia, all military expenditures are almost $2 trillion per year. $2 trillion per year. All military. All pharmaceutical expenditures is about $1 trillion, half of the military expenditures. However, if we look how much we spend for diseases, for diagnosis, for treatment, for hospitals, for all kinds of disease-related expenditures, this is $10 trillion. So $2 trillion all military expenditures and $10 trillion is all disease expenditures. And then, do you know how much we spend to prevent these diseases? Is $200 billion. So 1/5 of $1 trillion. $10 trillion for diseases and $200 billion for prevention. So therefore, if somebody tells me, oh, I am the Minister of Health of XYZ country, I always say, sorry, you are not Minister of Health, you are Minister of Diseases. Or if somebody tells to me, oh, I have health insurance, I say, sorry, you don't have any health insurance, you have disease insurance. Because the system, the capitalist system, is established on diseases and making tremendous money out of diseases. So medical education based on diagnosis and treatment, technology based on diagnosis and treatment, hospitals based on diagnosis and treatment, everything we call as health, they have nothing to do with health, but purely disease-oriented systems and expenditures. So therefore—
This is amazing. This is
all,
really unbelievable. A completely different take on health and disease issue that is not in the surface of any of us. Even I had a question. I had a reaction the first, who will say I choose disease? And now you provided enormous figures on the expenditures on the disease versus health. It really makes a very strong, powerful point. And what is your, in this line context, how to switch around?
Yeah. When Barack Obama was a candidate for presidency second time, about 6-7 months before elections, I received a phone call from United States, and they said, we are preparing a report for Barack Obama, okay? And we are asking opinion from all over the world, 20 people, from on different sectors, on health, education, transportation, housing, environment, etc. But, you know, maximum 15, 20 pages. How do you see United States from abroad? And what would be your recommendations to Barack Obama? So they asked me to prepare the health chapter of that report. I was, you know, happily accepted. I accepted happily, and I prepared the report and I sent it. And after a while, they called me again, Dr. Savas, we want to make a book out of these reports. Would you agree? I said, yes, of course. And they published new ideas from the world to redevelop America. And this is now published. You can find it on Amazon or internet. What I explained there, the American healthcare system, so with the rest of the world, should be shifted from disease-oriented to health-oriented. What I argued, this is not a technical issue. This is not very difficult to make this shift technically. However, politically, it is a big challenge. Can you imagine? So-called the biggest industry on the earth is military expenditures. This is $2 trillion. And disease industry is $10 trillion. So what I said—
I'd like to really point this, underline this. This is really, for me, when I never thought in that context, disease industry is 10 billion and military expenditure is
10 trillion.
10 trillion. I'm sorry, it's so big figures. 10 trillion?
Yes.
Did I say correctly?
Yeah, now it is correct.
Because even billion, it's hard to comprehend at the first point.
$10 trillion, 5 times bigger than all military expenditures around the world. So,
just the disease.
Here there is a big abuse of health of people. Now, you think so-called health system. What does health system mean? Hospitals, pharmacies, pharmaceutical industry, MR producing factories, all these disease-oriented expenditures. So, what should be for them to maintain their business? If they pray in the morning, what is their pray? Owner of a hospital, owner of a sickness insurance, owner of a MRI machine factory, their prayer is, oh my God, please give a lot of diseases, cancers, heart attacks, diabetes to the people, so I should maintain my life. All doctors, of course, they will not say it explicitly, but if there is no disease on the earth, all the disease industry will be starving. So therefore, the system is based on how we can maintain diseases. So we shouldn't kill people. We should keep them alive, but in a way that throughout their life, they have to go many operations, many analysis, many laboratory analysis, and pharmaceuticals, antibiotics, antidepressants, etc., MRI machines. So all these expenditures are not the sign of being a developed country. This is a sign of being a corrupted country. Corrupted.
In your opinion, what is the sign of a developed country within our context, health?
Well, we have to look at the distribution of health expenditure. How much they spend for the primary health care, how much they spend for hospitals, how much they spend to prevent people from the diseases, and how the health policies are embedded to all policies. I mean, health policy is not a policy which could be implemented, developed and implemented by Ministry of Health. No, tobacco consuming is nothing to do with Ministry of Health. It is Ministry of Agriculture, Ministry of Finance, Ministry of Industry, etc., etc.
And environment too.
And environment too. And clean water too. And exercise, that people carry out exercise, is the same thing. So these are only the government policies, state policies, not policy of the Ministry of Health. And as I mentioned before, there is no Ministry of Health in the world. All of them, they are Ministry of Diseases. So this is a big challenge.
This is something really I'd like to make subtitle with your permission. There is an Ministry of Health, there is Ministry of Disease. This is really a direct, powerful message and response to the question and to the title of the program, disease or health.
And I can tell 95% of all ministries of health around the world are actually Ministry of Diseases. Only a few exceptions of, Nordic countries, especially Norway is a good example. Denmark, not too bad. Sweden, not too bad. Finland, not too bad. But the rest, Germany, France, Italy, United States, all this rest of the world, Japan, they are focusing on diseases, and this is the main function of capitalism. So, because the aim is to make more money. So, my approach, 7K medicine.
Yeah, that will be my next question, with your permission. Yes. Now, how? I mean, yes, 7K, and you are the pioneer of the 7K medicine solution since 2004, and those are personalized, predictive, preventive, comprehensive, precise, evidence-based, and participatory medicine. And I
so
beg you
in Turkish words,
to explain it.
In Turkish words, kişiye özel, kestirimci, that means foreseeing the future. The third is the preventive, koruyucu. The fourth is kapsayıcı, comprehensive. And the fifth is kanıta dayalı, evidence-based. The sixth is precise, keskin. The seventh is katılımcı, participatory. So it was nice in Turkish to bring them in 7K. So
can we start from the last one, participatory medicine? I mean, I don't get that.
Okay.
Like I assume most people may not either.
Sure. All these diseases of 21st century, the most of the diseases are chronic and complex diseases, means heart attack, cardiovascular diseases, cerebrovascular diseases, cancers, diabetes, obesity, Alzheimer's, osteoporosis, etc. But these 8 diseases are 95% of all diseases and deaths. So
95.
Exactly. So if we want to protect individuals from that diseases, you have to work with the individual. I'm not calling them patients, because patient is a Ministry of Disease expression. I'm calling individuals. We have to walk throughout their life together, hand in hand. So it is not one time of intervention. It is a lifelong program we have to implement with a very individual. For that purpose, we have to walk together. We have to make decisions together. The individual should understand why they should take this action, why they should use this vitamin, why they should make this exercise. So for that purpose, we have to have a relationship among equals. Currently, medicine is a relationship between a higher level physician or health professional, and the patient is at the lower level. So this is a kind of parent-child relationship. So no, this is his or her life, and he or she should part of the decision-making process. And we, as the health service providers, should inform and empower the individuals to be able to communicate with us, to argue with us, question us. Some physicians, they say, oh, you are going and looking at the internet and reading something and now coming and showing me your information or your knowledge. You are not a physician. So what? For my patients, I tell, read as much as possible, and come and challenge me. Ask everything, why we are doing this. If you do not understand the logic of it, you wouldn't implement it for 50 years, because not to develop a cancer, you have to implement a lifestyle for 50 years, not to develop a heart attack, not to develop an Alzheimer's. So this is the participatory, katılımcı in Turkish. This is the seventh one. If I go to the
this
first
concept never introduced in Turkey, is doesn't it? I mean,
Well-
I am for the participatory in any concept. Health is much more specific and a life involved, and the person's weakness, and also health is very much related with the also social status. If someone is wealthy, they get better access. If they don't have social status well or very low, then they may lose their life because of just don't have that access. So in that context, how can we translate this?
Yeah, in Turkey and also in other countries, there is the information imbalance between physician and the patient. And patients are always abused because of this information imbalance. Let's say you will go and buy a carpet in Istanbul. You would have an idea. What is the good carpet? What is the bad carpet? You can ask, you can go several shops, and you can make your decision for the carpet, or to go to a restaurant, or to go to a hotel. As the consumer, you make your own decision. But in diseases, you don't make your own decision. You accept the decision of the physician. Because I tell to you, oh, you have this disease and you need to be operated. So no car dealer would tell you, you have to buy this Ford. No, it's up to me. I mean, I can buy Ford or Cadillac. It's my decision. But in health, in medicine, you cannot say this. You have to follow the decision of the physician. So therefore, supply and demand are collected in the same hand. In other areas of economies, supply and demand are separated. You demand a car, they sell the car. And interaction in the market, you make your decision based on the price, the color, whatever. But in healthcare, always physician makes the decision. And most of the time, patients would say, oh, doctor, please tell us what to do. We will, we trust you, whatever you say, we will do it. And therefore, there is a Hippocratic oath. So physicians should be a very virtuous individual. However, we are not. I mean,
but it's really a very challenging issue. For instance, I know from my mother, for her, doctors, medicine, prescriptions, anything is like anything suggested or prescribed is like got direction, got instruction for her health, and nothing, whether she never considered whether this is good or not. But also when we consider not only based on Turkey, but on the global level, education level, and also medications, any prescription, any information is not written on daily language. It's the medical terms, Latin language, kind of creates a barrier, basic understanding, even the educated people who are not in science, who are not studied medicine. How are we going to close that gap?
So this gap is there on purpose to create that information imbalance. So to leave people ignorant and to make the decisions. You think that, oh, doctor gave this medicine. Yes. And most of times doctors are doing it. It's a good intent. However, where they have learned about this medicine in a congress, a new drug in the congress. Who is financing congresses? Pharmaceutical companies. So the research is done by pharmaceutical company, and they organize the conference. They take the doctors, they pay their travels and holidays and everything. They take to the conference, and doctor thinks that, oh, he is learning the nice new developments. No, he is learning how to prescribe the new products of the industry. So here we have very strong, we need to have very strong public functions, which is not there, which is not there in Turkey, in America, in France, anywhere. How do we get there? This is the big problem. We need more virtuous individuals around the world. Not only physicians, but judges, the ministers, prime ministers. As you know, Turkey will go into an election. And I can tell you, not a single one of the parties, the governing parties or opposition parties, whatever they say is 99% lie. 99%. Because people are happy to hear certain things. For example, now the current government says, we will give in each Bayram, in each religious holiday, 5,000 lira. Then the opposition party says, we will give 15,000. I mean, do you pay it from your own pocket, from your father's farm, from your mother's factory? No. You are giving it from the future of my grandchild. However, today, both politicians and people are very happy to destroy the future of our next generations. The same thing
comes how to prevent, as your 7K, how to prevent from it. The question is.
It is a very difficult task, extremely difficult task. I can not imagine that I would implement it in any public health system during my lifespan. However, what I did during last almost 20 years, I developed all details for the future and put it down and described how it would be implemented in public health systems. So I am doing it now in my office in Istanbul, and a few thousand people are getting benefit of it. But the idea is all humanity should benefit from that, because we are analyzing genome of individuals, we are analyzing the lifestyle and current health status.
That goes into the 7K, right?
Exactly. Exactly.
So please elaborate on the genome we are pioneering and GENAR in connection with the 7K.
Yeah. For example, here we are a few people. And if you open any medical book, they say we need 400 micrograms of folate. It is vitamin B9 daily. So this 400, is it wrong? No. It is a general information. It is the average of society. But it may not be the right thing for Salih, for I, for Çiğdem, for Alev, for Serdar, for Bircan. This is like the size of a shirt. I mean, Alev would have 36, you would have 36, and Salih would have 42, I would have 44, I would have 54. So if you take the average, it is 42, but it doesn't fit. Maybe it would fit to one person. So all the medical procedures is based on society averages, which is wrong. Because yes, this is the average for society, but it doesn't work for me. So therefore, 1/3 of the drugs or vitamins, etc., doesn't give any benefit. 1/3 is harmful. 1/3 is useful. So we are spending 3, only 1 is healthy, 1 is harming, and the 3rd is doesn't matter. So that depends.
Dr. Serdar, I'm sorry. I'd like to really make this again an underlining point, especially in connection with GENAR. And for instance, when you illustrated this out of let's say 9, 6 are kind of not good or not effective or even damaging, only the 1/3. So how to, what is being in practice through GENAR and your expertise and your continuing health over last 20 years?
Yeah, we are analyzing the genetics. For example, I gave an example.
How do you put into practice? That's where what I'd like to understand.
Yeah. We take a little bit of blood, or sometimes sputum, or some tissue from the mouth, and then we analyze the genetics. 650,000 genetic characteristics.
Do you do this at the hospital, Hacettepe, or
no, not hospital, in GENAR laboratories.
In GENAR, okay.
By the way, in 2009, the current government closed down GENAR due to political reasons. But I don't care for such things. I continued my work in
it is closed now?
Yes, it is shut down. And I have continued my work in other countries, in England, in the Netherlands, in the Maastricht University, whatever. So no problem for me. Because this is a worldwide applicable thing. And the more important thing is not the laboratory analysis. The most important thing is to interpret information technology, to analyze all this data, and to look at the relationship between genetic infrastructure and disease risks. So that is the main skill or capacity of GENAR, and we do continue to do the
Where
job.
are we at in Turkey on the 7K?
Sorry?
Where are we in Turkey in terms of applying the 7K?
I mean, I can say, except my office, there is no implementation of it, unfortunately. Because it is against...
This is true worldwide too. I mean, in US is the same way.
Exactly. Right. It is now, and for many years, the Netherlands very much interested in my work. several universities, the Dutch government, etc. I think in the future, the first country who will implement this model, I believe, will be the Netherlands. But still, it is also difficult for them because the medical industry, this $10 trillion industry, is also very strong. And
no,
they have very...
indeed. What is your take on the GENAR and genetics and diseases, especially in reference to COVID-19 pandemic? I couldn't, stop myself not asking it.
Sure. I mean, actually, we could identify which individuals would have higher risk when they catch COVID. So there is a genetic predisposition. Most of the mortality is caused because of cytokines. When cytokines produced very high in the body, actually the body was killing itself. It is a kind of inflammatory chemicals. It is called...
So chemical provided the killing, you say?
Yeah, it is our body produces it. Our body produces it to protect itself, but it is so much that at the end, the protection material kills our cells. It is called immune reaction, inflammatory reaction. And it was possible to identify individuals who would have in higher risks. But it would be too expensive. And since during the disease, all governments were lost and they were not thinking properly, quietly, etc., that opportunity was not used, unfortunately. So actually, there is the relationship between the genetics of individual and COVID. It could be possible to analyze which person prone to develop COVID in a heavy case and maybe die in the hospital. It would be possible to identify it beforehand. Well, I mean, genetics...
Where does it say? I'm sorry, just because it's kind of lingering in my mind. Forcing the 80%, maybe they target the 100, but maybe it's in the 60-65% vaccine without really long enough testing and seeing the long enough outcomes of the vaccines, any of them, any company, any country. What is your take on that? I mean, is it a project to change our DNA? That's my kind of question.
Absolutely not. In my view, I mean, this is a conspiracy theory. Absolutely not. I mean, this...
No, this is also in connection with the disease, the investment in the disease and sustaining the disease versus sustaining the health. It's a kind of, to me, another way to relate that concept.
Yeah, but the vaccines are preventing us from the diseases. And in the future, there will be vaccines for cancer, vaccines for other things. However, the developing vaccines for cancers, etc., they are also controversial issues among the industry. So the companies who are working on only vaccine development, like BioNTech, for example, they are not very much supported by chemical, pharmaceutical, cancer drugs producers. So because they don't want a vaccine is there and their business is gone. So
They
I
make
mean,
some money that way.
exactly, exactly.
Maybe now another fundamental issues that you've been pioneer to establishing the nutrigenetics, Genomics National Scientific Advisory Board in 2004, and then the Nutrigenetics Association of Türkiye in 2005, which indicates that it was the first in the world. In this line, how this board and Nutrigenetics associations have served to the public health in Turkey, and since it was the first in the end to the world.
Yeah, I think we have fulfilled a very important task on this matter, because if individuals do have a nutrition program based on their genetic infrastructure, they can maintain a much healthier life in terms of developing heart attack or diabetes or Alzheimer's, whatever. So therefore, the interrelationship between genetics and food is extremely important. So this is, of course, a challenge to the current nutrition science, because current nutrition science says this is the ideal nutrition for an individual. But no, this is ideal for average person. We are not obliged to be an average person. So therefore, everybody should have a personalized nutrition plan, and the recipe of it is in our genes. So you may have a very fast metabolism for fats. I may have very slow. You may eat as twice as much fat compared to me. Your cholesterol will be 150. Although I'm eating very little of fat, my cholesterol might be 400. So it depends the relationship between food and the individual's genetic composition. So what I have introduced, one of the firsts on the earth, actually, we were a few people around the world at that time working on that issue. And we organized the first nutrigenetic conference in Istanbul in 2005. We brought many very good people from Europe, from United States, etc. And they were surprised. Oh my God, a couple of scientists in Turkey organizing such a conference. It is amazing what they said. So today, nutrigenetic is almost part of the curriculum of nutrition education. And there are many departments also in the United States. I mean, Artemis Simopoulos in Washington, Jose Ordovas in Boston, and then there are many others in California, etc. So there are very good people in the United States, but also in Europe, and also we are in Turkey. So in the future, if you go to a vending machine, you will show your QR code, and your milk will be served to you according to your genetic infrastructure. How
long do you think that will take?
Not more than 20 years.
Oh, not indeed, not too long.
This would be too late for our age. So we need to act faster than that. So we need help, like Bircan and my age to take faster action before these regulations come in place. So what do we need to do?
Well, first of all, you can start with yourself, because it is possible today to have all this information, to have all this analysis. I call them consultees. The consultees are perfectly benefiting of all this scientific findings. In the meantime, changing the public systems will take a long time, very long time. The humanity.
So it will start with the individual.
Exactly. This is what I am doing, because I tried to do it within the government, and they didn't like the idea, because all of the supporters of political parties are from disease industry. So disease industry didn't like the idea, of course.
Now, this is like we hear a kind of very clear message with the definition and descriptions of the disease industry. So in this line, if you, do you like to add something to conclude this section? Because I'd like to briefly touch on the World Health Day, and therefore whose 75th anniversary, in connection also your involvement with the WHO.
Well, I can say that today we are able to implement this Gentest and 7K medicine successfully. And I am and my colleagues, we have prepared everything for the future. If anyone wants to implement it, they can come and free of charge can benefit whatever we developed. I don't hide any information. And I hope one day the humanity will understand their future is in the health rather than disease, because culturally, people do not care about their health, but when they are ill, then they are getting panicky. I mean, just last week, one of my consultees, she was a little bit, spoiled lady, very beautiful, and, she thinks that she's the queen of the world. I was telling to her for many years, if you don't do, you will develop osteoporosis. And
what
now,
is that?
Osteoporosis, I mean, the bones are becoming like a sponge and broken. And at the end,
in Turkish.
Yes. At the end, she developed, and she tells me, "Oh, what will I do?" I said, "Look, at this moment, really, what we can do is very, very limited, because 20 years ago, I told you you have this risk, but you didn't listen to me. You didn't make your exercise. You didn't follow the instructions. You didn't take your vitamins, etc., etc." Now, mine is prevent. But now you are asking me to treatment. I am against treatment disease industry. We would be able to protect this, and it would be much cheaper. It would be more effective. Well, so therefore, this is a cultural transition also in the mind of people. People should understand that they should make necessary decisions and steps before disease develops.
This is very, very important message and knowledge. And really, I'm grateful that you accepted this interview just even without questioning. Then now you inspire me further. Maybe we may be kind of open the ways for open discussion to bridge between this knowledge through you to our communities. Perhaps this will be discussed later on. Now, because of the World Health Organization 75th anniversary, and April 7 is the World Health Day, which is celebrated annually and each year draws attention to a specific health topic of concern to people all over the world. The date of 7 April marks the anniversary of the founding of the World Health Organization, WHO, in short, is observed 75th anniversary on last Friday. In 1948, countries of the world came together and founded WHO to promote health, keep the world safe, and serve the vulnerable, so everyone everywhere can attain the highest level of health and well-being. WHO's 75th anniversary year is an opportunity to look back at public health successes, and we are grateful to you that you are enlightening us in this, that have improved quality of life during the last 7 decades. And yes, the education team is, as we had at the beginning, and you eloquently explain, Health for All, and who is 75th, who is a 75th, and sources WHO, that international. With that background, now, as we celebrate the 75th anniversary of World Health Organization through this program, your involvement started with WHO in Copenhagen in 1993 as the regional advisor for healthcare policies and systems. I developed a group of questions based on your large biography, but just maybe I will group in a brief. So if you could kind of explain them all together, then we can open up the session to our guests. What was involved this position? In this line, could you explain us how did you involve with the World Health Organization to begin with? Certainly you are not the only doctor in Turkey. It is what is the mechanism? Maybe it is very much for the who studies health or medicine, but just that was my curiosity. What was your core gain experience through WHO, especially in connection what you lay out just to us today? Do you have an active position at WHO as of today? And also you have listed in your extended bio 3 points, if you could explain on those. And you also structured the WHO in Europe. So in reference to those 3, what you contribute to WHO, can we say that you also pioneer of the SDG 3, along with the dedicated team for the 2023 World Health Day? Actually, you refer to 1977, WHO has the Health for All since 1977. So those are kind of my cumulative questions. The floor is yours.
Thank you. Thank you. So late 80s in the world, the politics were changing radically. So the Eastern Bloc countries were dissolving from communism. Soviet Union dissolved, and the neoliberal policies, the Chicago School, Freeman, and that politicians Reagan, Thatcher, Kohl, Özal in Turkey, there was this big storm of neoliberalism. And during these years, Turkey and former Soviet republics and also former socialist countries were facing really quite important problems. In 1989, I was part of a Turkish committee which worked on the health problems of people expelled from Bulgaria. I don't know if you remember, from the Zhivkov period, there were 300,000 people expelled from Bulgaria to Turkey, and they had terribly bad conditions. And I was head of the delegation, and at that time I was 29 years old, from the Ministry of Health, went to Copenhagen, the European office, to debate with Bulgarians and also with the WHO advisors. I can say that my negotiation tactics were quite successful. Dr. Jo Erik Aswald, he was the European director at that time. He was like a father to me after many years. And I first met him there. And he came to me, young man, you are doing a wonderful job and you are preventing two countries entering to a war. And I really admire what you are doing. So we met each other there. But after that date, I was invited by WHO European Regional Office to several meetings as a short-term consultant, as an advisory board. You know, they will develop a document. So Dr. Aswald really liked me and involved me to many activities of WHO, but still I am a civil servant in Turkey. Then I became Deputy Undersecretary in the Ministry of Health. Then I had more power. So I further developed the work, the relationship between Turkey and WHO. And WHO was very happy with that. I established a project office in Ankara to help the Central Asian republics together with WHO, etc. In 1993, I was taken from my position at the Ministry of Health due to political reasons. The day after, I received a phone call from Dr. Aswald. Said, Dr. Savas, I heard that you are taken from your position. Why you don't come and start with us? And I accepted. I resigned from my civil servant position. I went to Copenhagen and I said, okay, what I will do? He told me, you are a professional. At that time, I was 33 years old. He told me, you are a professional. I wouldn't tell to any professional what to do. Now you have 1 month here. End of the month, come and tell me what we need. End of the month, I went to him and said, well, you need a healthcare policies and systems program, especially to help the Eastern Europe, because Eastern Europe really is suffering, because they are trying to imitate the same health reforms like in England, like in Germany, like in the United States, but their infrastructure, their conditions are absolutely different. So it will be a kind of, suicide doing that. We have to warn these people. We have to show them what to do, etc. And he liked the idea and established this program. I worked very, very tight, intensive in former Soviet republics in Eastern Europe. Almost 5 years, we really achieved important successes. End of the 5 year, I told to Dr. Aswald, thank you very much. You invited me to WHO Euro. You have given to me lots of opportunities and lots of power. And I really enjoyed all these years. But I want to go back home. And I want to continue my work in Turkey. He said, no, 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 no. I said, how come? No, 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 no. He said, I have a challenge for you. You know, I was the regional advisor. Regional advisors are reporting to directors. Directors report to European program director, and he or she reports to Dr. Oswald. And we are regional advisors, the real technical people. Anything content is our business. Our directors, you know, they have nice positions, nice cars, etc. But they come to open my conference, they sign a letter to the minister, etc. But you know, it is not a real job. But European program director is a very, you know, strong position, and he controls all programs. When Dr. Oswald told me, I have a challenge for you, I thought that he will appoint me as a director.
What was that then?
And I said, Dr. Oswald, thank you very much. You know, it's a big honor for me. I am, you know, 37 years old, 38 years old, and you are asking me to become a director. Big honor. But, you know, it is not my cup of tea. He said, Serdar, do you think that I don't know you enough? Yes, but what? I will appoint you as the European program director. I said, oh my God, Dr. Oswald, I'm a Turk, I'm a Muslim, I'm a Schwarzkopf, as German says, you know, black hat. How you can appoint a European director, a 38 years old Turkish guy? How you get? I mean, the previous directors, the youngest was 65, 66, 67. I am 38, and I'm from Turkey. You know, I have no support of government, etc. He said, well, I will appoint you and I will solve all problems. We went together to Geneva. At that time, the world director was Gro Harlem Brundtland. She was the former Norwegian prime minister, a very clever and strong woman. And we had a lunch, and she said, Dr. Oswald, yes, I like this guy. You can appoint him. And I started to work as the European director. That was a big surprise for me. And there,
it's a great accomplishment. Congratulations, really.
He gave me three responsibilities. One was, Serdar, you have been criticizing us since you joined the organization. Okay. You are the responsible, solve it.
Fix it now. It's in your hands. That's a great challenge. Then and then you produce three solutions.
Exactly. And then
could you elaborate on those, please?
The second is we need a new health policy for Europe, health for all for the 21st century. You have to prepare this. And the third is you have to develop a model to prevent chronic and complex diseases. So because this is a big challenge, we are very successful in vaccine preventable diseases. We are working on environment, etc. But we are not very successful in, you know, heart attack and cancers, etc. So first two tasks were not difficult for me. I did immediately. And the third really is the birth of GENAR and Gentest. Because after a year, I went to Dr. Oswald. I said, Dr. Oswald, we develop diseases, whether purely genetics or purely environmental conditions or genetic predisposition plus environmental conditions and lifestyles. So the answer of a new policy for chronic diseases is here. And first time in the world, in a WHO policy document in the book, we mentioned public health genomics and how to prevent chronic diseases. But of course, at that time in 1999, we knew so little. But I had the understanding saying that, okay, it is there something. And then after 2000, I immediately come to Turkey, establish GENAR, and start to work on these ideas. I mean, the original trigger to my thinking for chronic complex diseases is pulled by Dr. Aswal, the late Dr. Aswal. He was like my father, really.
This is remarkable accomplishment, and we hardly knew it. And I heard of before GENAR and gene and genomics, based on especially during the early COVID era. I watch your statements and suggestions over the TV frequently when I was in Turkey, but I wasn't really understanding how within this context, and especially I even didn't know that you were the pioneer of many important public policy and genomics, and these 7 you father for Turkey. So this is really great opportunity for us learning our human potentials and accomplishment in the world, because we also have very negative self-perception about ourselves. Or we are Turk, we are Black, we are, you know, but this is one of the unique examples that you were top of the WHO in Europe, and also you were pioneer and presented and practiced many important issues, especially in public health and also genomics. Really, we are great honored to have you in this program. Before opening the floor to the our guests, I'd just like to ask, because the time, I don't want to take up all your time, and especially it's obvious that we're not going to get through everything I set out. Just it was kind of practice for myself as well, but I can't how they say skip the one because we are an NGO. So maybe last 2 questions back to back, although they are not very much related. Then I'm sure Alev Hanım from ATA, and she's the chair of the UN committee, and Çiğdem Yorgancıoğlu, and also maybe Salih may have, then, and we have also another Alpcan, maybe they may have some questions. So here we go. As we are a United Nations associated NGO with the Department of Global Communications, formerly UNDPI since 2005, and have been a bridge between the UN and the Turkish communities in the US and Canada in this line, for instance, alongside public health related ones, you are also a member of the Futurist Society of Turkey. That attract my attention. Could you also briefly share with us your civil society and NGO involvement and current status on that? And then the last, actually, it's not again related, but it's related all we discussed here today, all you lay out to us today. As the last question in my list, actually I skipped several of them, as you are aware of that. Dr. Savas, you are also author of 4 books, and you mentioned the US and also I think 1 book out of 4. Could you briefly introduce us your book, which title, just brief description, Silent Revolution in Medicine, Preventive Genomics, published in 2016. Thank you. It's your turn.
Thank you very much. Well, my NGO involvement, a few. The one is the Turkish Society for Public Health Genomics and Personalized Medicine. It's a scientific NGO. Another one is Virtues Citizenry Movement Society, Erdemli Yurttaş Hareketi.
It's a political one. That one is political one, isn't it?
I would say social. Of course, politics is there, but not with the meaning of the politics, but more policy. So what should be our health policy? What should be our education policy? What should be our transportation policy? And to which fundamentals should be the leading principles for our societal life. We established it in 2014, and it is quite active. And we are organizing Fireflies seminars. The next seminar will start on 20th of May. 5 weeks from 9 to 11 in the evening with Turkish time. And
in this year?
Only 2 hours, and twice a week, Saturday and Wednesday, and 5 weeks. So that is in total 10
Dr.
seminars.
Savas, I'm sorry. The sound was breaking in a little point. What is it going to be in this May or next year?
No, this May. We are organizing in every 8 weeks.
Is this in-person seminar, or do you have webinar style seminars?
Zoom. Always on the
Okay.
Zoom. We have minimum 6, maximum 12 people. And we don't teach anything to participants, but we promote discussion around a certain subject. We sent beforehand a video and a small text to be read, and then people are coming and participating. It is if anyone like to register, it is EYH, Erdemli Yurttaş Hareketi.
It is open to public. It is for members. Anyone can register.
Yeah, and free of charge. eyh.org.tr. There you can fill a application form, and our friends would communicate with you. And that is really recommendable, very, very interesting, and how can I say, it creates a lot of awareness. I mean, for example, today, I hope I was able to create an awareness of disease industry.
Indeed.
So
my mind.
it is very similar, different areas creating awarenesses. So this is the second my NGO work. Then I am also
Futurist Society.
Futurist Society. I am a futurist, and I'm untreatable futurist. So I am very optimistic.
Untreatable. I love that. Untreatable.
And the last area is my high school, Kabataş Erkek Lisesi.
Yeah.
I'm founder member of the Kabataş Foundation and Alumni Society. So these are the areas. But nowadays, during last 3 years, I was very busy with EYH, Erdemli Yurttaş Hareketi, Virtue Citizenry Movement. And I published a book called Manifesto. And you can actually reach the book on internet in my website. It's a nice book, I would recommend. And the book you asked is
The
Silent Revolution.
Yes.
This is again another attempt to create awareness about the role of genomics for the future and how it could be used in preventive medicine. And I could write this book in 6 months for physicians, but it took me 2 years to write it for general public because it was more difficult, you know, how
simplify.
Explain
simplify
it.
The language and terminology.
Exactly. But simplify, but not superficial. It should be deep, but simple to understand. Really, I spent 2 years. I like this book. I really like it.
Then maybe now with this information gives me another inspiration, as I inspired just by meeting with you on March 31st. And we brought this program such a short time. Now, maybe when you come to visit New York, maybe if you could have a book introduction on this book, will that be possible for the future program?
Of course.
That will be fantastic. So we will learn more about, and in the meantime, I will try to obtain the book and get more information and knowledge, and so that could be another session to plan and present. So with that, I'd like to open the floor to our guests, and I change the frame to gallery view so we can see each other. And yes, I'm sure Alev Hanım has some questions or comments. Let's start with Alev Hanım.
Teşekkürler. Thank you, Bircan Hanım. Serdar Bey, çok memnun oldum bugün tanıştığımıza. Sizin çalışmalarınızı yakından takip ediyorum. Ben doktor değilim, mühendisim, fakat sıhhat üzerinde çok okudum ve çok ilgim olduğu için yaptığınız çalışmaların çok değerli olduğunu candan inanıyorum. Çünkü özellikle kimyasal dünyamızda içtiğimiz sudan, yediğimiz yiyeceklerden her şey kimyasal şeylerle kötü bir şekilde tatbikat edildiği için sıhhatimiz maalesef bu alanda hasar görüyor. Ve buna çok dikkat etmemiz lazım. Yalnız dediğiniz gibi genlerle ilgili genom alanında yapılan çalışmaların özellikle Amerika'da çok pahalı olduğu için bunların tatbikatı çok zor oluyor.
Alev Hanım.
Efendim.
Alev Hanım, programı we presented the program in English and you are speaking in Turkish, so it will be difficult to incorporate. Could you switch to English briefly and get
sure.
the question?
Sorry. My apologies.
Briefly for your comment and question, please.
Sure, I will start over. Again, I am very glad to meet with Dr. Savas. I have been following his studies and his work closely. Although I am not a doctor, medical doctor, I'm an engineer, but I have tremendous interest into health-related subjects, because I personally have autoimmune disease, and since I have discovered I have this problem, I have been closely monitoring doing my own research and monitoring what I can do personally myself. Of course, from the water we drink to the food we eat, there is so many chemical contamination with pesticides, herbicides, and hormones that's injected into food. It makes it very difficult, even to a conscious person who is eating right and trying to do the right things. Sometimes it's not all possible to sustain health. I guess my question would be...
chemicals in there.
Yes, it's in everything. Of course,
What is then your question to Dr. Serdar?
Yes, I am getting to it. So the question would be, how a normal person, because I live in US, and doing a DNA study and trying to figure out how I should, implement a better choices is very difficult, because it's either too expensive to do. What would be your recommendation for a normal person who would be able to go do these tests so that they can implement, make better choices in life?
Yeah, I mean, it's not very difficult, especially during the pandemics. We had to develop different techniques to reach people without moving them from where they are living. So therefore, if you are in the United States, we just send you the kits, and then over the Zoom, we explain how to prepare these things. And then our colleagues will make an interview with you on health, and then again explain all these things. And then you will send back to us, and we prepare the analysis and the report. And then I make another Zoom meeting and explain to you, sending the report, but also explaining you over the computer. So it is not very difficult.
I see. So, I mean, you are in Istanbul.
Yes.
Okay. So as we come to Turkey, we could stop by or make an appointment to.
Oh, that would be
that would probably be better, easier to do.
Sure.
Great. Thank you.
And
where do you live?
Thank you, Alevan.
I live in Texas.
Wow,
in Dallas.
Where? In Dallas.
Dallas.
Okay.
Yes. We welcome you to Dallas.
I may.
It would be very, we have amazing medical teams here.
I know.
And it would be amazing to actually set up a seminar here.
Yeah, that would be nice. That would be nice. I mean, I'm traveling not very often, but at least once a year to New York because of my grandchild. So I was there last week for her birthday. So I can tell you that
our reason to meet.
every 3rd of April, I will be in New York until end of my life.
I hope it will be many more decades. So I'd like to also ask if Çiğdem Yorgancıoğlu, based in Istanbul, and she's also with the Energy newspaper, and she also cover our water conference. Actually, I also like to conduct with you, Dr. Serdar Savas, if possible, maybe within next 6 to 8 months, a special topic, water and health, because it's also kind of, it's everywhere, as Professor Ojay repeated the underline, but it's not really directly related water and health. It is very much, inseparable, in my opinion. And so
we could do that program together if you like, Bircan.
Comment? Excuse me?
We can do that program together jointly if you like.
We'll
it's a very good
discuss
topic.
Excellent. We'll discuss on that afterwards, because now I'd like to get if our other guests have a question or comment. Çiğdem, do you have anything? Maybe she's not active or behind the camera. Salih, do you have any comment, question? Salih Mansur is our volunteer, and he is really loyal. He joins us, support us whenever he can, and he is also researchers and academician. Salih, do you have any comment or question?
Yeah, first of all, I'd like to thank you all, Dr. Savas and Bircan abla, for presenting the opportunity. So my reflections on that, while doctor was presenting the issue, and I can understand him well since I study psychology. I am also part of a psychology research lab, which is focused on experience and trauma, which when we divert our focus, like, and you mentioned many times that Minister of Health is sometimes Minister of Disease, and also our focus on, instead of improving our health, we focus on wars and other stuff. We waste loss of world and human resources on almost nothing. So those resonate with me, that also, like, coming from a little bit self-developmental background, when we focus on like first on important things, and which I believe health is wealth, and also like I believe that your talk resonated with it. So I just want to like comment, maybe add on, just like from my perspective, like, and it starts within, and it starts with awareness. And I like to thank you and extend my gratitudes to you and people like you that always and every day try to raise awareness for very important issues.
Thank you.
Thank you, Salih. And Çiğdem is with us because her camera was off, so I wasn't sure whether she was hearing us or not. Çiğdem, welcome. Do you have any comment or question to Dr. Serdar Savas?
Thank you very much indeed. So it was very fruitful speech, though, and in the future, I would like to communicate with himself about my project, about how we can prevent violence at health sector. That's I have a project. I'm lecturing about this. And I've been to Expo, so maybe we can communicate about this one. And thank you very much indeed. Thank you.
Thank you. Whenever you want, I would be ready for
thank you.
any assistance.
Thank you, Çiğdem, and thank you, Dr. Savas. And now, Arjan, do you have any comment and or question, please? It's your turn. It's your opportunity. Can't hear you yet. Hello, we can hear you. Could you unmute yourself, please? Hello? Oh, he is sign off. Okay. So maybe either he signed off mistakenly or he wasn't feeling uncomfortable. But he was one of the first who registered and who has been with us from the beginning to end. So at least we call on him, right? Okay. Now, Dr. Serdar Savas, it's been really great honor and privilege to have you with us today, and I think he's reconnecting. Let's give an opportunity to him if we can. Hello.
Your microphone was on. Now you push the off button.
Maybe you need to unmute him.
I am trying, but hello. Can you unmute yourself, please? Unmute. I am requesting him unmute. Hello? Maybe you can write your question or comment briefly in the chat and I can read out loud because I couldn't. I am requesting you unmute and I am not. Maybe it's supposed. Hello? Are you here? I think, okay, no, we are not, I am, but he has to do something because I'm requesting him and is not unmuting. So maybe, so sorry, we can't hear you. You need to unmute yourself. Okay, okay. Oh, he says it's not letting me access my microphones. I am inviting him unmute, but it's not responding. Maybe something a glitch in the system. Yeah, for some reason I don't let me do to ask him for something about Wi-Fi. I don't have any question, but it was great meeting with both of you, and the speech was great. Thank you. Thank you for joining us. Thank you for signing up, and thank you for listening from beginning to this point. And also, as Dr. Savas recommended, his website is also in the chat box, eyh.org.tr. So I visited certainly, but I will also look for the seminar which you mentioned, and also look for the book also in your personal website. And so we are getting to the close, and I'm gonna take one shot. And also I'd like to ask your closing remarks.
Well, thank you very much for giving me that opportunity. And it was nice that it is held in English, because then on that video, I was explaining that in Turkish several times on YouTube, etc. But it was the first record in English. So it will help also me a lot. Thank you very much.
Thank you, and I hope to continue, especially as Ali Hanım also is willing to collaborate with us.
Sure.
Maybe our next timing might be from today, or maybe I'm thinking
May
July.
time frame, perhaps.
Okay. Let's say official closing, and I will close the YouTube and I will make the comments so it can be more personal. So
Sure.
okay. Thank you for all YouTube for the record. Thank you, and I am closing.